Thank you guys for joining us at the Reflection Room. Today we're joined by Dr. A. He's a board certified general surgeon and founder of Weight Success Centers in the Tampa Bay area. He has over 20 years of experience in bariatric surgery and a personal journey of overcoming binge eating himself. Dr. A brings a unique blend of medical expertise and empathy to the conversation we're having today, which is where we'll be diving into the mental and emotional side of weight loss. So we're super excited to have you here today, Dr. A.
I'm so excited to be here as well. I love this. This is a topic that's very near and dear to my heart.
Welcome.
Yeah.
Awesome. Yeah, we're really looking forward to this. Hannah and I know I definitely can say that this is the case. I'm sure Hannah, you can attest to this, but we oftentimes, especially lately with the uptake in the medications and, there are a lot of things surrounding that are trending. We've had a lot of people come into our offices that are talking not necessarily specifically about that topic, but just weight loss in general. And of course, anybody that has a phone now can see that that's all over the place, whether it's on ads or commercials or on social media. And so I think that we're having this conversation at the perfect time. So one of the first topics that we really want to talk about is food addiction a real thing? So the specific question we have for you today is this: do you believe food addiction is a real diagnosis, or would you say that it's more of like a behavioral pattern?
That's a really great question. And so the official answer is no, because it's not part of the DSM-3 yet, which it should be. However, people who have a problem with eating, that are addicted to extra food, I believe that's real. There have been studies that have shown that it lights up certain foods, high fat foods, carbs, high carb, simple carb foods are going to light up the reward centers in the brain, the same areas where cocaine does and opioids. There are many similarities with using opioids and cocaine with food, in the sense that you can have withdrawal. So if you are addicted to food, or you're using food as an escape, you can definitely have a withdrawal to that if you stop doing it. We see that a lot in patients who we do bariatric surgery on, because even though we do surgery on them and we stop their ability to eat more, what happens is the root causes what put them there in the first place, that what caused them to develop that relationship with food, it's not been touched for the most part. Okay, and then that withdrawal of not having their outlet happens, and they become very anxious and have very similar symptoms to people who are addicted to other drugs. In addition to that, it can absolutely get in. One of the things for addictive drugs is that it can get in the way of your daily activities. Do it despite causing harm to you. Absolutely, that's exactly the case. And you may be hypertensive, diabetic, your hemoglobin A1C may be through the roof, and may have metabolic syndrome, and still you do it. You eat the foods that you should be eating. You eat a lot of it. You turn to those foods. People may say, well, it doesn't really cause problems where you skip work or you have issues that gets in the way of your performance. No, it actually does. There's a huge numbers of days lost from work, and this is well documented for people who are overweight or obese, and really obesity-related diseases and problems. So absolutely, so it does actually meet all those criteria, and it really should be considered a food addiction and should be in the DSM-3, but it's not. If I may extrapolate on that a little bit, is that okay?
Sure.
So my personal journey with that was as a binge eater. I did not have a weight problem until I entered my residency program. And that was a severe, highly stressful program. That's all of them are. And I gained a lot of weight. So I was like 75 pounds over my ideal weight, where it should be. So it happened over the course of several years. It was difficult for me to get that off. But and also got worse after I graduated, and I went into private practice. I worked as a surgeon for many years, and I was just very big. And it wasn't until one day that my wife took some pictures of me with my son who had just been born, and I was in the pool, and realized, oh my God, that's me. It didn't dawn on me until that moment that, wow, I can't believe I've gotten so big. And so I had to make a change. At about the same time, a very good personal friend of mine who is a surgeon as well and was my mentor in residency, who also had a weight problem, had the lap band. that lap band had come out. And he had it, and he had lost all his weight and did very well with it. And he started putting in lap bands in people and helping people lose weight. And he said, "This is a great device. This is going to help people. You should get into it." And I did. No, I'm not going to do that. I had bariatric surgery. I had bad ideas about it in the past. It was not a great field way in the past. A lot of complications and issues and all that. But the lap band changed all that, at least for that time that the lap band came out. It was minimally invasive, did really help a lot of people. There are other issues associated with it, which we'll talk about later. But at that time, it was really a great device. It was helping a lot of people. It helped him, and he eventually convinced me to, start doing it. But I was heavy, and I realized, I'm not going to help other people if I can't help myself. And I'm not going to ask other people to lose weight if I can't show them that it could be done. So I did it myself. I didn't do it with surgery, but I did it on my own. It was very difficult. It took me over a year, but I lost about 70 pounds, and I kept it off. And then I started helping people with bariatric surgery, not just the lap band, but I did other procedures, gastric bypass, etc. And I was able to change a lot of lives, and I really liked it because here is something I'm doing that's positive. I'm helping people not just get healthier, but to change their whole lives, make their lives happier, give them their life back. And that really stimulated me, especially since my life was given back to me. So I wanted to do the same. So I switched my practice primarily to doing that. And then, fast forward, 23, almost 24 years, that's been the focus of my practice. I did, however, add medical weight loss to that, and we'll talk about that for many different reasons. But I was able to do that to help even more people because I feel that is what I'm here to do. Now, during that time, however, one of the things that perplexed me the most was two things. One, that even patients that I did surgery on, not all of them, but there was a good proportion of them, and not just me, it's everybody who does bariatric surgery. A good proportion of them gained the weight back over time. Myself, I was wondering, well, why did I even gain that weight? I should know better. When you kind of say all these things that really, it's not your fault, but you think it's your fault. And I had to think that way. And so I started trying to investigate that and come up in my mind what happened. And I came up with a cycle that I think explained it. And I called it the cycle of obesity. I published this many years ago. So it really starts with a life-changing event, or it could be more than one, but usually at least one big life-changing event that leads to chronic anxiety, a stress that continues chronically. In my case, it was that really residency, sleeping very little, a few hours, high stress situation. But it could be all types of different things. It could be toxic work relationship. It could be a toxic relationship with your spouse, a bad marriage, money problem. It could be moving to college all of a sudden and you're on your own. And it could be any type of abuse, sexual, physical, or mental abuse that you've experienced. It could be personality issues such as perfectionism. And we can talk about that a little later. So there's I identified about 7 to 8 characteristics that are root causes that put you into this chronic anxiety state. And it could be more than one, but there's definitely always one that's identifiable that puts you into this. And then that follows eventually with depression. And then there has to be an outlet, and you can choose all types of outlets. You can choose smoking, alcohol, you name it, but food is accessible. And food works, and food releases dopamine and serotonin in the brain, and it makes you feel good just like all these other things do. So then you turn to overeating the wrong things. Eventually that leads to guilt, because even though you may ignore it or you may in denial of it, you're still going to feel guilt. You know that this is causing you problems. And then that guilt adds to the anxiety you already have, and then more depression, and then there's a cycle. And the cycle goes on and on and on. And what I realized, and this is how I help my patients, what I realized is we're treating the overeating. With surgery, we're blocking your eating. With diets, and appetite suppressants, we're blocking your overeating. We're doing nothing for everything else. The root causes are still there. So this is a really good example of not treating the root causes. And what that'll do is, when we used to do bariatric surgery in patients, a lot of patients, as well described, may turn to alcohol or drugs. Why? Because the root causes weren't fixed. Only the outlet was changed. So really, if you look at that cycle, it's a cycle of addiction. And that kind of answered that question you asked me at the beginning. Is it an addiction? Well, yeah, I think it is. It kind of proves it. And so if you follow that cycle, you realize it's like the iceberg. You're headed to the iceberg. You see the iceberg. You maneuver around it, and you think you missed it. But what's going to sink the ship is the huge portion of that iceberg underneath that you didn't. And that's the rest of that cycle. And so I realized that I had to create a program that addresses all portions of the cycle so the weight loss can be sustainable.
Yeah, thank you. Thank you so much for sharing that. I love that because that was the second part of that question, right? Which is like the behavioral pattern. And the question is like what drives that behavioral pattern? And then as mental health counselors, like we recognize that, oftentimes there are some thoughts, there are some beliefs, and then there are some emotions that are lying underneath those behavioral patterns that we're seeing on the surface there. And you're absolutely right about you mentioned the word guilt, and then I would say probably also shame too, that's mixed up in that. Because oftentimes when we're talking to people about their eating habits, a lot of times it might start out as habits that are happening out in public. And then you begin to notice that their habits begin to then happen more so in private. So it's more so at night in the comfort of their own home when no one really is watching. Or I've had a few clients that it's in the middle of the nights when their spouses are sleeping or their family members are sleeping. So really there isn't an audience. Like no one is aware of what's happening. So no one is a witness of that shame or that guilt that's occurring there. And so I love how you were able to kind of tie that all together. Just out of curiosity, if you feel comfortable sharing, or maybe if you have just a general story, what does that process then look like after the procedure? Let's say whatever that weight loss procedure is for someone. What does that look like afterwards? We know what we do with our clients when we kind of walk them through that in counseling, but any suggestions for anyone that's, maybe kind of listening? What is that emotional or mental kind of program afterwards that you're kind of referring to, or if you maybe even have a personal story of your journey?
That depends on the root cause because root causes are different. If you are a perfectionist, then that is going to have to be helped by counselors like you. As you know very well, that CBT is quite effective for that. And so cognitive behavioral therapy, understanding that you don't have to be perfect, and that's really tough. But perfectionism comes in three different forms: self-prescribed, socially prescribed, and the narcissistic type. Uh, Self-prescribed means that you expect it to be perfect. And if you fall short of that, you're going to develop that anxiety that puts you and keeps you in that cycle. A great example of that is that people often confuse the person who has a weight issue and an obese patient as lazy and not wanting to do anything. It's not that. What I found is that really they're perfectionists, and if they can't do something right, they're not going to do it at all, the way they perceive it to be. So counselors like you will help a person manage that way better. And counseling goes hand in hand. You're spending all this time and effort, treating your overeating. You need to give the time and effort and spend the amount on that too, and treating the root cause. So perfectionism is also associated with all or nothing thinking, as you very well know. Either do it very well or don't do it at all. Again, that's usually perceived as laziness or procrastination. Why does somebody who has a weight problem won't clean their room, or they seem like a slut? Because they want it perfect, and they can't get it perfect. They don't want to face failure. So feeling of failure is another one of the root causes. So some of those kind of overlap and they're interconnected, but they are the root causes on their own merits. All right, so let's go to another root cause: toxic relationships. Sometimes that may not be able to be helped, but I've seen so many patients that are taken care of that are in a bad marriage or in some toxic relationship at work. And it isn't until they get away from that toxic relationship. Now, I'm not saying please divorce somebody or whatever, it's their decision. But I've seen that unless you get out of this, that stimulus, it's not going to get better. Okay. Or maybe even learn how to handle it. So let's say you toxic family member or friend, and this person is always writing you high, becoming a really stressful thing to you. Well, avoidance may not be possible, but how you handle the person is. So that's important to understand. And then if we head to the abuse part of it, we see a lot of patients who have obesity issues who have suffered some type of abuse, if not all three types. Mental abuse, see it all the time. You brought up with a mother or father or family member that is constantly saying how useless you are, and you don't look good, and you're ugly. I've seen all this. This is stuff that I've seen and heard. So this happens. Physically abused, you see that as well. Sexual abuse, very, very common. A lot of people who have significant weight problems have been sexually molested. Sometimes some of them even multiple times. And this can happen way in your, way back in when you were young or child or teenage. What happens is we see patients that have had this issue happen will develop a boundary around themselves by keeping their weight. Their weight becomes, it separates them from it, and it keeps people from noticing them, or at least they think it does. That's an impediment. It impedes your weight loss efforts afterwards, because what happens is as you start to lose weight, you may be noticed more. You may have issues that you're seeing that people are noticing you. And all of a sudden, subconsciously, your body just stops the whole process. It wants to stay safe in that zone. And the typical patient we see like that would have bariatric surgery, or is on the GLP medications, or maybe an appetite suppressants, or a diet, or the gym, whatever, and they lose weight, and all of a sudden they stop at like a brick wall, and there's no getting past that no matter what you do. And that's typical of that, because they're not ready to do that. That is their safety zone. And one of the things we do to help them with that is, in addition to get counseling, is we tell them we're going to go at your rate. We're going to go as fast or as slow as you want us to go. And we want you to take control, because what happens is they took control away from you. That was the whole point of your abuse. That's how the abuser gets off, taking your control. We have to give the control back to you. We're going to go as fast or as slow as you want us to go. But the only thing you cannot do is gain the weight that you lost back. Okay? But we will go at your rate, and we will help you through this. And also, we want you to look in the mirror and talk to yourself and come up with different things that people may say to you, and what response you're going to have to them, and how you're going to respond to them, and come up with that as well. So that's really, really helpful. And we've had a lot of people succeed with that. Now, again, this is just a small part. It's a whole system approach to this. It's not just, do this or that. We have to do everything in combination and help them together. These people may have a tremendous amount of stress and anxiety. So we have to look at, how we can manage their stress and anxiety levels. Are their hormone levels okay? I used to not believe in hormones and think that hormones are a bunch of fluff, but on the contrary, I think what has spurred me to be is my perfectionism, because I am a perfectionist, and always wanting to do better. And if my patients gained weight or didn't lose weight, I took it personally. So I always was on the lookout, what else can I do? What else can I do? What am I missing? What am I missing? And I started checking into hormones, and indeed, there are patients where their hormone levels are through the floor. They're rock bottom. And testosterone is necessary in both men and women, but testosterone it's an amazing mood stabilizer. And I'm talking about bioidentical testosterone. I'm not talking about the anabolic steroids that bodybuilders get roid rage and all that. The bioidentical testosterone, like the one in your body, is actually a mood stabilizer. And I'll tell you how many patients we have checked it, find that we're really low. We put it at a more normal level for them, and they're able to come off their anti-anxiety meds, and they're able to stabilize their mood. And again, all these things taken together are going to help the whole person. This is why we do a holistic approach to weight loss. We have to help the whole person. We have to treat the rest of that iceberg. We have to get rid of it. So that's how it works. So in essence, long answer to what you were asking is that it depends on what the root cause is, and you have to address it appropriately. It's not just give you an injection, send you home, and hey, I'll see you in a month.
Yes, exactly. Which I absolutely love, because I see some of those commercials on, TV where they're selling, it's like these online or app, businesses or organizations where they're selling these weight loss medications, and that's outside of my scope or my niche, so I won't necessarily comment too much on that. But I will say, it seems like those organizations are missing what you're talking about here, which is all of that other that goes along with the weight loss process, which is so imperative for someone's overall health. I love how you said that you're a perfectionist. It may not necessarily help in some areas of your life, but your patients seem to be benefiting from it, because it really gets you to look at what is it that we're missing, and to try to provide them, the best overall care that you can. So I think that's great.
Yeah, one
Yeah.
of the things let's touch on those GLP medications, because again, one of the most important things that we explain to our patients, and this is, if anything, I want anybody to get from this podcast, is the following message, okay? Is that appetite suppressants, surgery, GLP medications, all they're going to do is buy you time to make permanent changes. That's it. They're not going to resolve your problem. They're going to buy you time. They're going to remove, well, let me clarify. They're going to buy you time to make permanent changes. I was going to say they're going to remove the food noise, but what a lot of people don't know is that bariatric surgery and the traditional appetite suppressants like phentermine and the usual that control hunger, that's what they do. They control hunger, but they don't control cravings. Okay, cravings are different now. And cravings are up in the brain, lack of dopamine, low serotonin, and you're eating the foods that are going to make more of that. Okay, but those do not block that. But the GLP medications do. And it's for the first time we actually have a tool that we can use to block those cravings and block the reward centers in the brain, at least temporarily, so that we can remove the food noise. So that when we can let you make those permanent changes, help you through those permanent changes and deal with those root causes and deal with the effects of those root causes, because we haven't even touched on those, because there's another layer to this. There's the effects of the root causes, is lack of energy, lack of sleep, carb addiction, difficulty sleep, weight loss plateau, etc. So these things all have to be treated. But if we remove the food noise, and this will help us, wait, I tell you, it makes all the difference in the world. Now, this is only temporary. Okay, so that people understand. Oh, I gained the weight back. Well, yeah, you gained the weight back with surgery too. Gain the weight back with anything, because you didn't change everything. You didn't change the structure of everything. You have to help you with that. It's only going to buy you time. And people, there's lots of studies showing that people can, they compare GLP-1s with surgery now, and everybody's talking about, oh, the surgery will keep the weight loss 2 more years longer than GLP-1s. And it may be true. But my personal experience, that's my experience, surgery buys you about a year to make those changes. If you haven't made the changes in a year, you're not going to. GLP-1s may buy you, I don't know, 4 months maybe, and so will the appetite suppressants. If you don't make the changes during that time, you're not going to do it. It's not going to happen. Okay? If we put you on these things and you keep eating whatever the heck you want, this is the problem also I saw with a lot of bariatric surgery patients. God bless them, I love them. But when they get their surgery, they think, oh, I got my surgery, I can do whatever I want. I'm still going to lose weight, no big deal. Yeah, in the beginning it is. But then as time goes on, you stretch your pouch, you eat more, and you'll gain your weight back. So you have to make those changes. No matter what you do, it always funnels into the same thing. You have to make those permanent changes. About it is, in the beginning, it's tough to make them. It's a little bit easier now with the GLP-1s because it's blocking your cravings. So it actually makes it a lot easier to do it. But once you do them and you do it and you keep it over time, it becomes easier and easier and easier and becomes second nature to you. But again, the root causes have to be treated, because the root cause is still there. That's going to continue to feed and put you back into that cycle. And let me tell you one last thing. Okay, I love talking about that. I can talk about
No,
this.
I love it. I love it.
Yeah.
But one last thing, if every time you go back into that cycle, it gets worse. Why? Because the guilt goes up. Remember, that's a very important feature of the cycle, right? So you lost the weight. You didn't treat the anxiety. It reared its ugly head again because of whatever the root cause was, or the root cause came back into the cycle, depression, overeating, guilt is through the roof because, hey, I failed. And now it has, and then every turn of that cycle is worse. This is why when people lose the weight and they gain it back and then some. So
That's
that
true.
explains that. So very important to understand that cycle really predicts everything. And so, and also the other new thing about that cycle that it's predicting, which is really, I love it, because I wrote this way before these things were happening. But now you got TMS, right? Transcranial magnetic stimulation, very effective in a lot of cases for depression. But now they're looking into it for anxiety, because it's actually helping people with anxiety, and many other situations. They're looking at it for anxiety that leads to weight loss. So they're using it to help people lose weight. And there's a big company called BTL, which is creates M-Sculpt and all these other things. They're more aesthetic and cosmetic stuff, but they developed a new machine called, I forget the name of it, but ExoMind, which is really nothing more than a TMS device, but it appears to do what TMS does in 12 sessions, so it'll do it in 6. But nevertheless, it's a TMS device, but they've been using it for anxiety and helping weight loss. So guess what we're treating? The cycle. We're treating the anxiety with the TMS, the depression. We're treating the overeating with the medications, and then the guilt will fall into place, because once you get rid of the other ones, the guilt will actually go down. So we're actually treating the cycle with that. So I love it, because now I think finally people are seeing the whole scope of the picture, which they didn't see before, and that's necessary. If we want, this is a new era in weight loss, and this is really how we have to look at it now. It's just not going to work to put you on something and get you to eat less and And I hate it when the people say, "Oh, eat less and exercise more." Well, those people who say that have never been heavy. They've never been obese because it's really difficult to do that. It's not your fault. I mean, everybody is like, "It's your fault, Peter." It's not your fault. All these things are playing in there, but you have to understand them so that you can help them.
Wow. Yeah, I really love your holistic approach. I feel like it's rare. And like you said, it's like people are starting to get it, but like you've understood this for a while.
Yeah. It's
Yeah.
nice. It's nice that it's finally coming to play. It also works in with surgery. Surgery is still a great option, but surgery is not the option that people think. Again, I'm not trashing surgery. I think it's a great option for a lot of people. I still do some. It's wonderful, but you have to be really prepared because hey, we're really going to block your overeating. And if your cycle is really, really tough and the rest of that cycle is really prominent, it's a cult. It's just a shock to you, a shock to your system, and your stress levels will go through the roof and you're going to decompensate. So you have to be so mentally prepared for that and so in a place where that cycle is really not a problem anymore. And surgery helps. Even like that, adapting to surgery is hard because we have gastric bypass. You have to adapt to eating completely differently and making sure you're not eating things that are going to cause dumping syndrome and maintain your nutrition appropriately because you get very malnourished with that. If you The lap band's making a resurgence now, which I think is great because the lap band is minimally invasive, and it's a new company called Reshape, and it's a really great adaptation to the lap band that they created. I digress for a minute here, but the thing is, the lap band in the past went out of favor because we weren't treating the rest of the cycle, right? So people were still stressed out, and they would eat and just overeat and overeat and overeat, and things would get stuck, and you had to empty the band and let things pass, and then get inflammation, maybe a slip of the band, all types of problems. So, and then adjust it again, and blah blah blah, went back and forth, and that became a problem. And so, because again, cravings, it doesn't block cravings. You're going to have those cravings, and the cravings come from your stress. So what happened is that the lap band went out of favor. But this new company, Reshape Life Sciences, did the lap band now where the tubing has these two um, decompression chambers in the actual tubing. So if something gets stuck, the fluid from the band will back up into these little chambers. Whatever it is passes, and then the fluid goes automatically right back. So it'll prevent a lot of the, inflammation, feeling bad, throwing up, feeling like everything's stuck. It's not enough. Now we're realizing, and this is what I'm something really, really excited about working with this company because I want to start using the GLPs, not the GLP-1, but GLPs. I'll explain why. I want to start using them to complement that, especially initially at the beginning when they get it, because what we want to do is we want to eliminate the cravings and allow them time to adjust to the band and not to have that food noise and allow them to change their habits a little bit. So then when we eliminate the GLPs and just use the band, they're not going to be, doing the issues with the craving and eating the wrong things and dealing with that. So I think using that to transition is going to be a really great thing. And there's a lot of data showing that using the two in combination is really working and delivering great results. So I'm excited about working with the Reshape Life Sciences on this, and we've discussed this several times, and I'll be doing that. But that's really interesting how that works, and it helps people adapting, with the band. So it's important to understand that surgery is not a cure-all. However, it does have a good place if you're in the right spot to do it.
Yeah, I love that. And it's very similar to our field too, where there's, as time evolves and as fields, continue to kind of grow and advance, there's so many different options, for people out there. And so I love hearing you talk about all the different options. And I can tell that there's such passion and excitement, when you do talk about it. And so it says a lot about how much you love what you do, and it really comes across. And so we're so grateful. Thank you so much, Dr. Aguila, for really speaking with us. I feel like we can go on and on. I know I can. I'm so passionate about specifically my personal journey, and nutrition has helped me in my overall mental health. And so I can talk about this forever, but we're so grateful that you took the time out to chat with us and our audience. Where can people find you if they are interested in hearing a little bit more about you, or even speaking to you and your team, and are interested in some of the options that you guys offer? Where exactly can they find you at?
Well, we are online, of course, on our website, weightsuccesscenters.com, weightsuccesscenters.com. And I call it Weight Success because that's exactly what we are. We are committed to your success. We are doing everything possible. Now, the way we do the GLP injections here too, because we do all types of different treatments and we also manage everything else associated with it. But the way we do the injections here is that we actually have the patients come to the office. We don't send it home to them. And because we want to see them every week and we want to take account of any issues that are affecting you so we can treat them as well. The GLP injections also your body tends to get used to them very, very quickly. So you have to keep micro adjusting the dosage on a regular basis. You can't just do a dose for a month and expect to lose weight. Your body gets used to it, and we have to kind of microdose up that dose every week or bi-weekly, depending on whether you're losing weight, you're having cravings or hunger, and also if other issues are presenting that we can manage as well. Like we talked about this whole segment. So we want that contact. We want you in the office. We want to see you every week. We want to weigh you in. We want to talk to you. We want to make sure that you're doing well and you're going to succeed. And we do everything in our power to help you do that. Okay, we go out of our way to do that. Our staff is wonderful. Everybody in our staff, except for one, have all lost weight, and we have all had our own personal journeys. So the other one can eat whatever heck she wants and doesn't gain any. Whatever. But
Yeah.
but she's wonderful. She's terrific too. But we're there to help you. We really are into it. So you can see us in Tampa and Brandon. We have 2 offices. Our phone number is 603-7804, and you can contact us there. It's 813-603-7804. Liza is wonderful. She's our MA, and she answers the phones and really helps you. She understands that she's lost a tremendous amount of weight herself, so she knows where we're coming from. Always get a hold of me as well. I do see the patients. I'm here for them, and we're always helping. So those are the ways they can contact me.
I love that. And if you were a representative of your staff, I'm sure that they would have a wonderful experience with you guys. Yeah. Thank you so much. This has been really great. We really appreciate your time. And thank you guys for listening. Hopefully this was really informative. As always, if you guys have any questions or any comments, feel free to jot them down below and we will do our best to get back to you. And we will end this segment as we always do. Keep reflecting.